thank you for joining us on this SAG-AFTRA live stream on YouTube. To stay informed about all of our live stream and video events, we invite you to subscribe to this channel. You can go ahead and do that right now, SAG-AFTRA on YouTube. Today, we present the President's Task Force on Education, Outreach, and Engagement live stream, A Return to Work, Putting Protocols into Practice. The presentation will begin momentarily. If you have questions that you'd like to direct to today's guests, please email pteoe@sagaftra.org. That's pteoe@sagaftra.org. We'll be pausing throughout so that our ASL interpreters, Justin Maurer and Maria Bassani Santa Maria, can trade off to ensure that we have consistent interpretation throughout the presentation. As a reminder, today's program is being recorded and you can watch the replay right here on SAG-AFTRA at YouTube later in the week. Now, please give a warm welcome to today's host, SAG-AFTRA President, Gabrielle Carteris.
Thank you, Pamela. Hi, everybody. Welcome. I hope that you are all staying healthy and safe. I'm excited. We have a full house today. First, we're being joined by our Executive Vice President, Rebecca Damon. Hi, Rebecca. Nice to see you. As well as our National Executive Director, David White. Hi, David. I just want to say, I am actually, before we begin, I want to say to both of you and to everybody actually who's been involved, how grateful I am for the work that has been done. This partnership has been truly, truly special. I'm grateful that we're able to do this work with our members. And what I believe is actually this work is probably the single most important agreement we've signed in decades. And we could never have done it without everybody's participation. So thank you again. So as you know, this week, SAG-AFTRA, along with our sister guilds and unions and one of our largest employer groups, the AMPTP, formally agreed to and adopted safety protocol guidelines on our return to work. Finally, yay. The final protocols are based almost entirely on the Safe Way Forward safety protocols that were released in June. Many of you are familiar with those. For the safety of all of our members and other production staff, it's very important to know that we must follow these guidelines. We cannot and should not opt out of these protections in any way because it's the only way we can really ensure the safest way possible when we go back to work. I also want to recognize and thank our sister union partners with whom we developed these protocols. It's been an incredible experience. That was the Directors Guild of America, IATSE, the Teamsters. Thank you all. And I don't want to leave out, of course, our leader members. They have been amazing. Our health, safety, and immunology experts and employers with whom we work to finalize this agreement. Again, it has been an experience unlike any other. And it's so satisfying to feel that we can really collaborate during a challenging time in our work lives, in our lives, period. You can find both the final industry-wide agreement and the Safe Way Forward protocols on the SAG-AFTRA website, and that's at sagaftra.org/return to work. Now, we know how painful it has been for us to be out of work since the COVID crisis first began. It's been devastating for so many of us. And charting a safe path back to work has been our #1 priority. Now, I know there's still a lot of work to be done. So as that goes on, it will keep you informed as we continue to nail down every last detail, because believe me, there are a lot of details. We've been working on these protocols night and day throughout the weekends to make sure we can bring something that would be reflective of what we needed as we re-enter work. So I'm hopeful and very proud of the progress we made, and that after today's presentation, I hope you feel the same. You can find both the final industry-wide agreement and the Safe Way Forward protocols on the SAG-AFTRA website. You just go to sagaftra.org/back-to-work. Before we go into today's presentation, I just want to give our National Executive Director, David White, an opportunity to say a few words. And before I do that, David, I'm sorry, I just wanted to say one thing. Duncan, you really have been an incredible leader and inspiration, and thank you for your hard work. I know you will be hearing this from many people throughout, but really, I wanted you to hear it from me. Anyway, please, David.
Great, thank you, Gabrielle, and good morning or afternoon to everyone who's joining, depending on where you are in the world. We hope this finds you safe and your families and loved ones safe and well. Let me echo just great appreciation for the member leaders and our staff who worked on this, a couple of whom I'm going to name in a moment. But to begin by letting everyone know that this is a process that we've been dealing with since the start of the pandemic, but really in earnest to develop these safety protocols since late April, early May, and in the negotiations with the AMPTP since June. And it was something that we all hoped to complete by the end of June. But it turns out keeping people safe in a production environment is terribly complicated. And it actually took us this long to negotiate these details and to ensure that our members would be safe on a set. So this is tremendously important. We're so glad that people are joining to make sure that you have the information that you need. It is science-based, as you will learn. And I cannot express enough the appreciation that we have for the sister unions and guilds who participated with us. You may hear some of this in the presentation, but there were moments where each of us stood up for one another and held strong for the priorities of our union. So our performer and broadcaster and recording artist community here, we're talking about performers, but we stood strong with the members of Teamsters, IATSE, and the Directors Guild, and they did the same for us at very key moments. And it was only through that solidarity that we were able to push through and to get done what we needed to get done. So on behalf of the staff, my sincere thanks to Gabrielle as president and the Blue Ribbon Commission that you had put together that was at the ready to review all of this and to speak on behalf of members, and Rebecca Damon, who provided tremendous leadership on that group along with our other member leaders. And as I think about the work of our staff, I want to begin by giving great thanks for the one who will be presenting these protocols to you today, Duncan Crabtree Ireland. He is our COO and our general counsel, and at a certain point took the lead in this, working with Ray Rodriguez, our chief contracts officer, certainly myself, and a wide number of our staff who contributed throughout this process, including Cedric Jackson, who is our industrial sanitation person, and a number of folks whose names you recognize if you deal with our contracts team at all. This was an incredible group effort, and Gabrielle's correct. This was work in the evenings, late at night, on the weekends, early in the morning. Everyone did whatever it is that we had to do to bring this home. And now that we've brought it home, we want to make sure that it's communicated well to you. So with that, let me introduce our general counsel, our COO and general counsel, Duncan Crabtree Ireland, who will be presenting to you today.
Thanks, David. Thanks, Gabrielle. Really appreciate that, and excited to be presenting the details of the return to work agreement today. As you pointed out, David, this started out as a process we thought was going to be a lot faster, and instead it became took over 3.5 months to get this agreement reached. But I think it is really important and far-reaching, and it's going to allow for a resumption of work in a way we haven't seen yet. And I know that's something that our members are extremely excited about. Before we launch into the detailed pieces of that, I do, first of all, going to put up a slideshow as my custom. Anyone who knows me knows that without a slideshow, it wouldn't be a Duncan presentation. But I do want to just note that throughout everything that we're talking about, it's important to recognize that this is not about creating an environment that is 100% safe. There is not, during this time of COVID, a situation where we can guarantee safety, or that producers or anyone else can provide for 100% safety. So in everything that we're doing, it's about mitigating the risk and reducing the risk of COVID infection in connection with employment. And so every single member of SAG-AFTRA has to make a decision for themselves about what levels of risk they're prepared to accept and whether it's the right time for them to return to work. But for those who are ready to return to work, we believe that the protocols that have been agreed with the producers and with the other unions do provide a level of safety in the workplace that makes it appropriate for people to be able to return to work. And that is a science-based decision. This is not a political decision. It's not a opinion or just positioning. This is based on guidance and advice that we've received from the epidemiologist that is consulting with SAG-AFTRA, renowned epidemiologist Dr. Jonathan Fielding, and also the numerous other epidemiologists and industrial hygiene experts who've consulted with us and with the other unions that have been part of this process. So without further ado, I'm just going to launch into the presentation. As you can see, it's called Return to Work, Putting Protocols into Practice. And there are four major topics that we're going to cover that we're calling the keys to safety in this presentation. And there'll be a lot of details, so I'll try to go quickly, but not too quickly. And my apologies in advance to the ASL interpreters. If I'm going too fast, someone will let me know, hopefully. The four major areas that we're going to touch on as the keys to safety are, first of all, and preeminently, testing. And we've listed it 3 times because it's so important. Testing, testing, testing. The testing protocols we will discuss in detail, and without having testing, it really is impossible, especially for performers, to return to work in an environment of safety because of the fact that there are limitations on performers using PPE, personal protective equipment, and also having physical distancing when they're performing on camera. So we'll talk a lot more about that. Second of all, there's the zone system. This is the mechanism that works in combination with testing to help make sure that performers and others who are particularly vulnerable on set are protected and that access to them is limited as much as possible, so to prevent the spread of COVID. Third is personal protective equipment. I think everyone hopefully is aware of the scientifically established benefits of using PPE, and that is enshrined in the safety protocols as well. Obviously, performers will not always be able to use PPE, so a lot of the protocols are designed around helping protect performers and others during those times when PPE can't always be used. And finally, COVID compliance supervisor, which is a person who is specifically charged with overseeing COVID protection measures on the set and making sure that other people who are busy doing their regular jobs aren't the ones who are responsible for also making sure that the COVID protocols are followed and enforced on set. So first of all, let's talk for a minute about testing. Our testing protocols are based on science, and we have established through a number of models that have been prepared by our epidemiological advisors. It is clear that testing does work to minimize the risk of the spread of the virus on set. And for anybody who wants more details on this, there is a document that's available on our Back to Work site at sagaftra.org/back-to-work. It's called the Safe Way Forward. It's a joint document that was prepared back in June by the 4 unions that we've talked about. In part 2 of that document, there's a detailed explanation of why testing works to minimize the risk of virus spread on set, and showing the results of over 200 scenarios that were modeled by the epidemiological advisors to determine what the testing schedule ought to look like. Most performers, as far as the testing schedule goes, will be tested prior to starting work, and then 3 times per week during the time that they are working on the production. So almost everyone who's going to be working on the set, really everyone who's going to be working on the set, will be tested prior to starting work. And then there is a variation in the testing schedules depending on what zone you're in and what level of risk you might be subjected to as part of your work. Performers are all part of Zone A. We'll talk about the zones in a minute. And so performers will be tested 3 times a week unless there's an exception, either more frequent testing, perhaps for various reasons we'll talk about, or in rare occasions there might be less frequent testing for other specific reasons that we'll talk about. To be clear, producers are responsible for paying for testing. There is no scenario in which performers should be paying for their own tests. Also, performers should not be put in a position of having to use public testing facilities like government-provided tests that are provided for free. It is the responsibility of the producer, the employer, to pay for the cost of testing, and that is what you should experience. If you have any problems along these lines, please let SAG-AFTRA know so that we can address it for you. Moving on to how this works with respect to casting and auditions. First of all, for casting and auditions, all first auditions should be virtual unless there's a specific reason articulated why an in-person casting session is necessary. This has become the norm already, and we do not expect there to be a problem with people fulfilling this requirement. And obviously having virtual casting is the best possible way to prevent the possible spread of COVID in connection with auditions and casting sessions. In addition to that, actors should be receiving scripts, rundown schedules, et cetera, digitally. And if there's a need for a confidentiality agreement, that should be able to be signed through digital means as well. The goal of that being to avoid the need to pass paper back and forth, to avoid the need for in-person contact any more than necessary. And again, reduction of COVID-19, the risk of COVID-19 spread. Physical distancing is going to be something that we see throughout the course of this presentation, and in fact is a key part of the protocols, just like it is in daily life. If there is a need for a live or in-person audition, so meaning people do have to come into a place to do that, those auditions should be scheduled in such a way as to space performers out, and to also make sure that physical distancing can be accommodated both in any kind of waiting process and also in terms of the actual audition itself. Finally, there will be a lot of use of technology as part of a way to try and reduce COVID exposure. And one of those is for casting auditions, the use of an app or other means, other technological means to notify performers when it's time to come into a casting area, so that there's not a need to have people gathered in waiting rooms or mingling in a setting where that might promote the spread of COVID. So moving on from casting on auditions, we're going to talk for a minute about what happens when you're traveling to the job. And so obviously that could mean traveling by air, which some of us who have frequently been doing that in the past, that's been cut back on significantly, but it still is going to be necessary for a lot of performers who take jobs outside of their local area. The first thing to know about a situation where you have to travel to get to your work site is that there will be testing. If you're going to fly from your home area to a work location, there will need to be a COVID test done generally within 48 hours prior to your departure, and that result needs to be received before you get on the plane. So that's a key piece for two reasons. One, making sure that you're healthy, and also making sure that you're not put in a situation where you travel somewhere and then end up having to quarantine or being unable to seek your normal health care under those situations. Also, of course, during any course of travel, and really during any work time where you're not on camera or under makeup and hair, there will need to be PPE worn. So masks will be an essential element of that. Of course, sanitation is key. And so that involves you yourself sanitizing your personal areas, and also making sure in the protocols that workspaces and even transportation options are properly sanitized as well. For example, for local transportation, if you're being transported in a producer-provided vehicle, that vehicle will be subject to sanitation procedures to make sure that high-touch surfaces are routinely cleaned and that there's physical distancing within the vehicle. And actually just jumped right ahead to the physical distancing. And that is indicative of the fact that physical separation is really important. Obviously, people are aware of the 6-foot physical distancing guideline, and that is to be maintained in the course of transportation as well. Now, let's talk about the zone system, because this is a crucial element and works in conjunction with testing in order to make the work environment as safe as possible. So what you see here is a graphical depiction of what zones A, B, C, and D might look like. We're going to talk about what each one is for a moment. I do just want to note, this is just a sample, of course. Different sets will be configured in different ways. And so they won't necessarily be circles. They won't necessarily be nested within each other in this exact way. This is just to help explain the concept. So zone A is the first of those zones. And zone A is where you will find performers, anyone who has to work in proximity to performers, and anyone who would be working without PPE and without physical distancing at any time during the course of production. So that means, of course, all of the actors and other performers who might be present on set, including background performers. It also includes, for example, hair and makeup people who would need to be working in proximity to those performers while those performers aren't wearing PPE, because of course it would be difficult to have makeup done while wearing a mask. And it also includes people like directors, ADs, other crew who need to be in proximity to performers while those activities are occurring. Do want to mention and emphasize that the number of people in Zone A is intended to be limited as much as possible. So anyone who can do their job without being in proximity to performers while they're not wearing PPE or physical distancing should not be in Zone A. Those people should be in Zone B. And that is the responsibility of the producer to identify who should be in which zone, but that's the understanding. So that's what Zone A is. It's the sort of the central zone of the hot set where performers and those who have to work with performers will be found. Let's move on to Zone B. Zone B is often going to be an area that surrounds Zone A, although it doesn't necessarily have to surround Zone A. It can be really anywhere. And this includes people who might interact with performers, but would do so while wearing PPE and maintaining physical distancing. So some examples of that would be wardrobe, the wardrobe or costume department, as well as the props department, and a whole bunch of other crew who may be involved in carrying out activities that don't require direct contact with performers, but do require them to be in proximity to the hot set. And so the testing requirements for Zone B are different than they are for Zone A because of the fact that they interact with performers in a different way. And the level of risk to performers is lower because of the lack of interaction without PPE or physical distancing. And I don't know if that means that I should pause for a moment for a transition in interpreters, or if I just keep on rolling. So if you can give me an indication, that'd be great. Okay, I think that's what's happening. So I'm gonna just take that as my pause and continue on if that's all right. Moving along then to Zone C. So if you are an aficionado of the Safe Way Forward document, you will know that, that Zone C is something that doesn't show up in the Safe Way Forward document. This is the subject of some continued discussions with the company since the time that document was published back in June. Zone C is really intended for people who work in settings that are separate from the set, but who might on occasion have incidental contact with people who work in Zone A or Zone B. So examples of this would be like workshops where there are carpentry or electrical activity going on off-set that then have pieces will be brought to the set. It includes people working in a production office who don't come to the set itself, people like that. The testing protocol for Zone C is also a little bit different than it is for Zones A and Zone B. To be clear, all of the people in all of the zones will receive a pre-employment COVID test, but Zone A is the most frequent, with standard testing being 3 times a week. Zone B, standard testing would be 1 time a week, and Zone C, standard testing would be once every other week. Then we go on to Zone D, and Zone D is really limited to people who work entirely remotely from the set. So that would be people who work at home, for example, and don't ever come to the set or to a production office or work in an online environment. There are some other descriptions than that, certain office workers who work for the studios, et cetera. But in essence, those people are not people who interact with people on the set or in Zones A, B, or C. And I do want to note that if anyone from Zone D or Zone C were to need to come to the set, they would need to undergo the testing protocols that are applicable to Zone A or Zone B as appropriate. So there's also going to be health screening. So in addition to COVID testing, there will be on a daily basis a health questionnaire that will be asked of people coming to the set. And there may also be temperature screening depending on the producer's individual protocols. So some of the producers are going to use phone apps as a way to do this pre-screening to simplify it before performers arrive on set. So you may be asked to download an app, or they may provide you a link where you can use your smartphone to go and answer these questions. They should be very basic questions, probably questions that all of us are somewhat familiar with now, about whether you are experiencing any symptoms of COVID, whether or not anyone in your household has tested positive for COVID or experienced any symptoms, or if you yourself have tested positive for COVID, things like that. And you'll be asked those questions on a daily basis as a way of making sure that if somebody is experiencing symptoms, that they do not end up coming to set and potentially infecting other people with COVID. So the one way that that will happen is through this health screening app. There may be other ways. In some cases, there may just be a paper-based questionnaire when you arrive at the set, but did want to alert everyone that it's likely that a number of productions will use the app for this purpose. Okay, we already covered that. So when you arrive at the set, what's going to happen? Well, first of all, you're going to need to do a check-in process when you arrive at the set. All sets are basically going to be closed sets in the sense that there should be no visitors on set who don't have a legitimate business reason to be there. It is in the interest of all of our members and also of the productions that the amount of exposure to anybody be limited as much as possible to avoid outbreaks on set. That could endanger people's health or could cause production shutdowns. So everyone will check in when they first arrive. If you've already done your health questionnaire on your app, then that will have already been taken care of. If not, you'll do it at the check-in point. If PPE needs to be issued to you, that would be where that would happen. And if temperature screening is occurring, which is what that little graphic is meant to represent, then that would happen at this point as well. And you will see that the COVID safety team, which is a specific team of personnel on set, indicated in this graphic by the little crosses on them, are the ones who are responsible for carrying out those COVID safety procedures and making sure that that's happening consistently with everyone who's arriving on set. So let's pause to talk about personal protective equipment for a minute. First of all, it's important to note that the return to work agreement requires the producer to provide personal protective equipment to everyone who's going to be working on the set. So when you arrive, they should be providing you a mask, a face shield if necessary, etc. If you have your own equipment that you want to wear instead of the PPE provided by the producer, that is possible, but it must be approved by the COVID supervisor on set in order for you to do that. And the intention of this is that really people need to wear appropriate PPE. This is not an environment where people should be wearing bandanas or handkerchiefs or things like that. We want people to wear well-fitting cloth face masks, et cetera. It doesn't need to be N95 masks or anything like that, but it does need to be something that's really suitable for a full workday in an environment, a safety-conscious environment. And that's the responsibility of the COVID safety supervisor to enforce. In addition to that, I do want to just note, in accordance with the return to work protocols, this and a whole bunch of other things, these are steps that are required. So you are required to wear PPE. You're required to wear a mask on set whenever you're not on camera or having your makeup or hair done or something that would prevent you from being able to wear your masks. Otherwise, just like the rest of the cast and crew, or the rest of the crew, everyone needs to be wearing masks during the time that they are on set. Continuing on, let's talk for a minute about the COVID compliance supervisor. This position has gone through a number of titles since the beginning. So if you've been reading along from the white paper through the Safeway Forward document to now, the title has morphed into its final form of COVID compliance supervisor, although some companies will call it by other titles, most likely. The COVID compliance supervisor's responsibilities are to ensure that there's full compliance with the zone system, to make sure that all testing and screening procedures are followed rigorously, to oversee safety on the entire production, including those pieces I already mentioned. Also making sure that PPE is provided for and used by all of the cast and crew, and that all areas are sanitized and safe, and that physical distancing is maintained. So the supervisor on a large production will have a team of people working with them, COVID safety assistants and others who will help them do these activities. In small productions, there may just be one COVID compliance supervisor. But in any case, the COVID compliance supervisor needs to have taken special training for the purpose of ensuring that they know about COVID and are in a position to do a good job of overseeing COVID compliance. And it's also important to know that the COVID compliance supervisor under this agreement has the power to pause production completely in the event there is a COVID problem that warrants that. So this is a high-level person who has authority to make sure that COVID compliance is a priority and that no one is exposed to COVID health risks as a result of people not following the safety protocols. Oh, and sorry, I forgot that hand hygiene stations and sanitizer are broadly available as well. Let's talk about how this applies to makeup and hair, because I know from talking to performers that's something that's of great importance. Obviously, performers, when having makeup and hair done, are not going to be able to wear masks during that time period. So part of the protocol is that makeup artists and hair artists are supposed to wear not only masks, but also face shields and gloves as appropriate during the time that they are working on close up on a performer's makeup or hair. I do want to make a side note that gloves as a general rule are not required. In fact, they're not even advised by health authorities for a variety of reasons. But when it comes to close up work on someone's face like this, wearing of gloves is appropriate and provided for by the protocols. Also, there needs to be sufficient physical distancing and ventilation between the different makeup and hair workstations to ensure that performers are safe while they're sitting there being worked on without their PPE. So the physical distancing would be maintained, but obviously the PPE would not be used. After the time period when the individual performer has finished their makeup and hair, there will be a sanitization between each person of the makeup or hair station. And also that performer, if possible, should use a handheld face shield that would let them have some protection while moving from a makeup and hair station to the set or on set between takes, etc. Obviously, wearing a regular mask might disrupt makeup and hair, so that's problematic, but using a handheld face shield is another option, and producers are responsible for providing that as well. There are some additional makeup and hair protocols we wanted to touch on. I've mentioned already that the makeup artist must have full PPE at all times while they're working on performers, and there will also be hand hygiene before and after working on each individual's hair or makeup. And the idea is to strictly limit the amount of time when PPE is not worn by performers. So makeup and hair should be done as close in time as possible to the actual move to the set for the performer to perform. In addition, there are protocols requiring that specific makeup and hair tools be assigned to each performer and not shared between performers. That if you have non-disposable items that are going to be used, that they must be cleaned with appropriate disinfectants that are approved by the EPA for COVID safety between any uses, and that all supplies need to be kept in individual cast bags for each individual that's being worked on, so as to avoid any chance of inadvertent exchange of tools or items. In terms of costume and wardrobe, we have some specific protocols for that as well. The wardrobe department areas are generally going to be designated as Zone B because of the fact that for most wardrobe purposes, performers will be able to wear PPE and maintain physical distancing. But if there is a need for costume or wardrobe personnel to work in close proximity to performers, then they'll be designated as Zone A. Only the wardrobe department personnel will touch wardrobe items until they're provided to the performer as a way of making sure that the amount of contact is limited and that the chance of any COVID through contact is reduced. And each performer is going to have their own costumes and outfits separated so that they don't come in contact with the costumes and outfits for other performers, again, as a way of preventing any kind of COVID transmission. We also have a requirement that the items of wardrobe have to be disinfected between each use and before they're provided to the performer with CDC-approved chemical solutions and methods, and that performers will need to have a separate private area to receive a costume or item and maintain appropriate physical distancing. And if a performer is being dressed by a costumer, PPE must be used, of course. We also have a requirement that the producer plan in advance for things like wardrobe fittings and other access to the wardrobe and costume department so as to avoid overcrowding by performers in the costume and wardrobe areas. And as part of that, there's a provision stating that cast should be booked as early as possible so as to have more time to get measurements or to do other things necessary to prepare for their costume and wardrobe needs. And if there are items of costume or wardrobe that can't be disinfected using regular protocols, it's important to note that quarantining can be an acceptable alternative. By quarantining, we mean taking those wardrobe items and leaving them unused and untouched for a sufficient period of time to assure that the COVID virus will have degraded due to the passage of time and not be infectious. We also have protocols for the prop department, and that includes things like the prop show and tell being done virtually as much as possible, or if for some reason it can't be done virtually, that it be done in a separate area so as to avoid the need for any kind of additional people being present. That only members of the props department will touch items until it's clear what's going to be provided to the actor. And that any set pieces, props, and surfaces that performers are working on or with will be sanitized before and after use. Additionally, when it comes to on-set food, we're going to talk about food for food for lunch and meals in a minute, but for on-set food, all of the food safety protocols that apply for COVID prevention also, of course, must apply when preparing food for use on set. And there's a recommendation that multiple setups be prepared for purposes of ensuring that the amount of contact with those food items on set is minimized. Also, personal effects of performers should remain with the performer at all times, except when personal necessity items on set are maintained in their own designated safe area so that other people don't touch them and so that they're kept individually separated. And finally, any kind of stunt equipment, mats, pads, etc., are to be cleaned either by or under the supervision of stunt personnel, because obviously it's really important that in the cleaning of those items, there isn't any degradation of the items, and that whatever cleaning methods are used are consistent with the items themselves remaining functional for their safety purpose. So now let's talk for a moment about voiceover, ADR, and looping protocols, of which there's a specific section in the return to work agreement. First of all, if you are doing voiceover, ADR, or looping, you have the right to ask the producer to consider letting you work from your home or personal studio if you have one. The producer is not required to agree, but they are required to consider that request in good faith. Second of all, any kind of recording booths that are used for voiceover, ADR, and looping must be cleaned between each use by a different performer. So every time a performer comes in or out, the surfaces in there need to be cleaned, and also those confined spaces must have 100% air exchange by either ventilation to outside air or filtration. And the filtration, there are specific standards. I won't go into them all here, but they're listed in the return to work agreement. And voiceover, ADR, and looping performers should be provided digital scripts wherever feasible, so as to, again, avoid the unnecessary exchange of paper or contact between people. And in the event that contactless sessions are possible for individual or solo voiceover, ADR, and looping, meaning a session in which there's no significant contact between the performer and any other person in the process of arriving at, doing their work, or leaving the studio, then those contactless sessions don't require COVID testing on the part of the performer any more than a session done at home or in their own personal studio would require that. So there are going to be additional protocols to come that aren't in the document right now, but are underway or being worked on. We have agreements in the document to discuss additional protocols with the AMPTP for group voiceover, ADR, looping, and group singing. Those are areas that need some additional work and will be the subject of a supplemental protocol. In addition, protocols for work and smoke and work and airborne particulates. So there are currently studies being done that are close to completion on the question of the impact of work and smoke in connection with COVID particularly. And so we are eagerly awaiting the results of those studies to inform further protocols as it relates to work and smoke. In addition to that, there are other protocols that we've already published, so you can find these on our Back to Work site at sagaftra.org/back-to-work. Those include protocols for singing, and we have additional protocols that are also forthcoming, including protocols for other contract areas such as commercials, music, etc., and protocols for other work categories, including stunts, dancers, etc. And yeah, so those are our protocols. We want to also talk a little bit about eating on set. As you can, this graphic does not imply that there is not to be eating on set, because of course, as people, we all need to eat. But what there won't be are open tables full of food that are just for people to come up and grab. There won't be buffets. There won't be self-service. There won't be shared utensils. Instead, the protocol specifically call for individually packaged meals that don't require any sharing of utensils or service stations, lineups for buffets, or anything like that. So that's how those will be provided. Those meals may or may not be hot meals, depending upon the logistical capability of providing hot meals in an individually packaged form, but they will be nutritious meals as required under our contract and provided by the producer. There will also need to be physical distancing maintained during times while people are eating. So there's a specific provision requiring that eating areas be provided that have enough space to allow for 6-foot physical distancing between all the members of the cast and crew while they're eating. This may result in meals being done in shifts rather than being done all at once in order to enable sufficient space for physical distancing during meals, but nonetheless, that will need to happen. Okay, continuing on. we want to talk a little bit about rights and responsibilities that you have both under labor law and also under the return to work agreement. If you feel unsafe on the set, you have the right to raise your concern with production. That includes speaking to the COVID compliance supervisor. That would be a great person if it's a COVID related issue to direct that to, or one of their assistants. There is a specific provision in the return to work agreement that requires the COVID supervisor or one of their COVID safety assistants to be on set at all times. Doesn't mean they can be everywhere at all times, of course. So you may have to find them. On the call sheet, there will be a mobile phone number for them and also for an anonymous reporting hotline. So you should be able to get in touch with them as needed. And that would be a great place to report any concerns, but because they have the ability to take immediate action to resolve those concerns. Obviously, there may be times when you, for whatever reason, don't want to or don't feel comfortable raising your concern directly with the COVID supervisor. And in that case, and even if you have raised it with the COVID supervisor, please contact SAG-AFTRA to let us know what the issue is, and so that we can assist in addressing it if needed. Obviously, we may or may not have a field rep on set on that particular moment on that particular production. But if you alert us to a safety problem, then we can address it. We can immediately reach out to production. We can have a field representative go out to the set if necessary, et cetera, to make sure that that issue is addressed. And the return to work agreement is a publicly released agreement. It's on our website, again, at sagaftra.org/back-to-work. Fair warning, it is fairly lengthy. It's almost 60 pages long, but in your free time, you're more than welcome to read it cover to cover, so to speak, and to know that all of the provisions in that agreement are mandatory, and you're absolutely within your rights to insist that they be enforced. And if they're not being, again, you can reach out to us and we can take action to help make sure that that happens. We will be providing also summaries of the agreement on that same back to work site. So those of you who don't want to read an almost 60-page agreement don't have to do that. But it is open and available to everybody to check it out and to understand the exact details of the whole agreement. You do have some responsibilities as well. One of your responsibilities is that for the safety of all your fellow performers and crew members, you must comply with the health and safety protocols. And we're going to talk a little bit more about that in just a minute. I do want to emphasize that, and you'll find this in the return to work agreement, if you feel that your life or health is being seriously threatened by something that's going on set, you have the right to refuse to do that. It's in the return to work agreement. It's also a protection in federal labor law. I urge you, if you feel like you're in that situation, to look out for your health and make sure that you feel confident in asserting yourself. I also encourage you to immediately contact the union on our Safer Set hotline. We'll give the number for that at the end of this presentation, and so that we can wade in and help you as well with respect to your concerns. Now, it is important to note that right is for legitimate safety concerns only. It's not a right that can be used to impact contract negotiations or to try and negotiate for more money or anything like that. We're talking now about legitimate safety-based concerns on the set that have a significant impact on you. So when it comes to wrapping the day on set, there will be a checkout process. And for those who are continuing on in production and are on a regular testing schedule, that checkout process will in most cases also include a COVID test for your ongoing testing schedule. So if you're testing 3 times a week, let's say you're working a regular Monday through Friday schedule and you're being tested on Monday, Wednesday, and Friday at the close of work, then on your way out when you check out, typically that will be when a sample is collected for purposes of testing. Not everyone will be on that same testing schedule, so you may be instructed to report at other times for testing and at other locations as well. But we're expecting that that will be one of the most common ways that people on ongoing productions will experience that testing protocol. So there's obviously the question of what happens if you were to test positive for COVID. And so this this is a really important question, and we're going to talk about it both from how it impacts your work on the set and also how it impacts you from a financial perspective. But if you do test positive for COVID in one of either the pre-employment test or the or regular test going on during the course of production, the first thing that you're going to need to do is self-quarantine. So you will be directed by production not to report to set. You'll be asked to self-isolate, and you'll be asked to contact your medical provider for further treatment with respect to COVID. Obviously, depending on what your symptoms are and what your situation is, what that treatment might look like is different. But one thing that is clear is once you're in that situation, you won't be returning to set to continue work until such time as a sufficient quarantine time has passed to assure that no one else will be exposed to COVID as a result of you having contracted it. This leads us into money issues, because a lot of the money issues related to this return to work agreement have to do with either when someone comes down with COVID, or with the testing process for COVID, or with the quarantine process for COVID. So let's start by just reiterating something that I said at the very beginning, which is the employer is responsible for paying for COVID testing. So no one should be confused or in any way convinced by someone that it's somehow your responsibility as a performer to pay for COVID testing, because that's just not the case. And if anyone were to say that to you, a producer or anybody else, please contact the union so that we can help address that problem. For the time that you spend getting tested, there are in some cases specific compensation provided for that. So let's talk about that for a minute. So if there is a day when you are required to get tested outside your home and you're not already doing any other work for the producer, if you're a performer, other than a background performer, you will be paid a $250 stipend for that day for your testing time. That stipend is a 1099 payment. It's not a wage payment, and it is not subject to benefit plan contributions. And by the way, for those who might wonder, that is a standardized testing payment that applies across all of the unions. So DGA, IA, Teamsters, us, everyone with the exception of background performers who's getting paid will be paid that flat stipend rate. I do want to note that certain performers will not get paid extra for testing. That includes series regulars on television series and certain Schedule F performers. And that's in connection with their guaranteed production period. But performers will be paid that stipend if testing on a day when you're not already doing any other work. If it's a day when you're already doing other work for the producer, whatever that work may be, then the time it takes for testing will simply be added to your work time for that day, and you'll be paid in that manner. For background performers, there will be a $100 stipend paid, again, for any day that you are required to do testing outside the home when you're not doing other work for the producer on that day. However, there is a special provision, and I'd like to take a quick moment to just acknowledge two things about this special provision regarding benefit contributions for background performers. Number one, I want to just particularly acknowledge that the other unions, the DGA, IA, and Teamsters, really stood with us in solidarity in making this contribution happen, because as I mentioned, there are no benefit plan contributions on this payment for any other worker in the industry other than background performers. But because these contributions are so important for background performers' ability to qualify for health coverage, we were able to all stand together on that point. And it was actually a very moving moment when the representatives of the DGA, IA, and Teamsters made it clear to the producers that we would not have an agreement if we didn't reach agreement on this point. I also want to acknowledge that David White, our executive director, personally intervened to help make this happen. And this was a very tough sticking point, but it was due to those two factors that we were able to achieve it. And what it means is any background performer who tests, who then is subsequently employed on the project, will receive a benefit plan contribution for that $100 stipend that they're receiving, so that it will help them achieve alternative days eligibility if needed for the health plan. Continuing on, in the event that you were to test positive for COVID or have another COVID related event. So testing positive is one of them, but it's not the only one. There's actually 6 different categories of events that can trigger your COVID sick leave. One is yourself becoming tested, testing positive or having symptoms. Another is if someone in your immediate family is in that situation and requires your care. And there's 4 other scenarios beyond that where this applies. There will be 10 days of COVID paid sick leave that can be used to compensate you for unpaid work time during those COVID events. And some of those are listed there on the slide. Any employee who goes on to COVID sick leave is entitled to be reinstated to their position so long as their position continues to exist. And for performers, what that means is so long as that position hasn't been recast or eliminated from the production. So if you have a role and as a result of a COVID incident, you aren't able to work, if that role is maintained and not recast, then you have a right to go back into that role. Obviously, if it gets recast, then that won't be the situation. So that's going to be a case-by-case determination. And with certain limited exceptions, employees who are required to quarantine or isolate at the request of the employer, or if required by law, will receive quarantine pay. So this is another area that was extremely hard fought in the course of these contract discussions, and actually was open until the very, very end of the process, and another one where David White was able to really personally intervene to get this addressed. But for the longest time, it wasn't the case. The companies were not prepared to make payment for quarantine pay for any series regulars or Schedule F performers on television series or feature films. And we were eventually, with those efforts, able to move them off that position so that series regulars who are paid on the lower end of the scale, as well as Schedule F performers below certain thresholds, will in fact be entitled to quarantine pay, even if that quarantine occurs during their guaranteed production period. And of course, the rest, all other performers who would be requested to quarantine or required to quarantine for those reasons would be compensated in accordance with the Schedule B weekly minimum for that time period. I do want to also note that as far as COVID sick leave goes, COVID sick leave is intended to replace income that you lose as a result of being unable to work due to COVID. It is capped. There is a maximum of $750 a day for that, and there's a maximum of 10 days, as it says in the first bullet point, of coverage per production, per producer. So it's an important income replacement tool for people who might test positive for COVID, but it does have certain limitations, although those limitations are significantly greater than what they would be under local law for sick leave that's been provided for under various local laws for COVID. Want to just go back to a topic that we touched on earlier. Actually, Gabrielle mentioned it at the beginning of the webinar, and I hinted at it in a previous slide, but I want to be more explicit about it. Safety protocols aren't optional. These safety protocols that are contained in the Return to Work Agreement are mandatory for everybody on set. They're science-based, and they're in place for the protection of everyone's life and health, and they only work if everyone participates in them. If anyone is not following the safety protocols, it undermines the safety of everyone on set, and all of the unions and the producers have agreed that that's simply unacceptable. So to be clear, the protocols are mandatory, and that means that with the sole exception of legitimate ADA-based modifications to protocols, there are no exceptions to the safety protocols, and everyone is required to follow them. And when I say legitimate ADA-based modifications to protocols, I do want to be clear. That means if somebody has a legitimate documented medical reason that they need a modification to the protocol, then that will be the subject of an interactive process between the producer and that individual and the union as appropriate. And I do want to be clear, no one's going to be exempted in a blanket way from protocols. If someone has a health condition that requires a modification, there'll be a modification. It doesn't mean that they will just be exempted. So that's what people should expect with respect to safety protocols. And I do want to be clear that anyone who fails or refuses to comply with the safety protocols can be discharged by the employer. And individuals who are in that situation should understand that the union will not be in a position to do anything about that. If you're refusing to comply with safety protocols, then the employer will be within their rights to terminate your employment, and the union will not be able to get additional compensation for you. The union will not be able to get you reinstated. So please be clear that everyone needs to follow the safety protocols, And if there is some justification for an ADA-based modification, that needs to be discussed in advance and cleared through the appropriate process for them. So in terms of how you can address concerns, questions, and get more information, number one, please contact us. We're here for you. You can reach us at the phone number listed here, 855-SAG-AFTRA. You can also email us at info@sagaftra.org, and we can try to address as quickly as possible any questions that you might have. I don't mean questions right now during the webinar. I mean just in general for going forward. Please always feel free to reach out to us and speak to us about your concerns. If you have an on-set emergency related to COVID, you should contact our Safer Set hotline at 844-SAFER-SET. And that hotline, by the way, is available for any kind of on-set safety issue, including harassment, et cetera. But it is certainly available for COVID-related incidents as well. And our team of first responders will be notified and immediately try to respond to your concern. You can find these numbers on your membership card and also in the SAG-AFTRA app, as you can see there. I do also want to mention, I've mentioned it a couple of times, that we have a lot of resources available on our Back to Work site at sagaftra.org/back-to-work. I urge you to go check that out as well. There's a whole repository of documents, including the full text of the Return to Work Agreement for you to peruse. But there are also the other detailed protocols that I mentioned. If you never did get a chance to take a look at the Safe Way Forward document, that's there as well. And there are a list of resources available in the event that you have friends or colleagues or you yourself are engaged in production. There are a list of resources for producers, including testing vendors, including PPE sources, and a whole host of other information that's extremely, I think, helpful. That's also where you'll find us posting updated protocols, and there are FAQs posted there as well. So if you have a question that for whatever reason we don't get to during this webinar, then the answer may already be there in the FAQs in our Back to Work site at sagaftra.org/back-to-work. And as you can see, that is right down here at the bottom of this last slide. And I think this, now that it says Q&As, means it's time for me to turn it back over to Executive Vice President Rebecca Damon to lead us through that process. So thank you.
Great. Thank you, Duncan. That was just so helpful. I think, you know, for a lot of us, some of us need to hear it. Some of us need to read it. Some of us will probably go back. I got several texts during the presentation from folks going, will this be available online? So I'm just going to throw out that for people that want to hear the presentation again, it will be available on the YouTube channel, as Pam mentioned at the top, because it really is a lot of information. And for those of us on the commission who've heard it a bunch of times, it's like digesting, but I really do think the repetition helps so people can have their expectations and know what to expect and what to ask for. The presentation was terrific. I want to ask you, we have a bunch of questions, so I'm going to just try to get us through as many as we can. The first one says, I understand that this is a live stream for the AMPTP agreement, but they're very concerned about commercial sets, and they wanted to understand what the progress of the union making an agreement with the JPC in terms of COVID testing and other things on commercial sets. So obviously, the science is the science, but that people would love to get input on that. They also had another part to the question. Is the union doing anything to lobby city officials to get the law changed in LA County to require COVID testing on commercial sets? And thanking you, Duncan, for your hard work.
Oh, well, thanks very much for that. Those are great questions. So let's talk about commercials for just a moment. A similar process is going on right now with the JPC regarding commercials. However, it's a little bit more complicated because in the case of the AMPTP, all of the unions I mentioned, we all negotiate with the same negotiating partner, which is the AMPTP. In commercials, SAG-AFTRA negotiates with one entity, the JPC, and those other three unions all negotiate with a separate entity, the AICP. So we are coordinating our efforts and we are trying to push forward basically similar protocols that would be adjusted for the purposes of the type of short duration productions that most commercials are. In the meanwhile, we're doing individual pre-production meetings with commercial producers on every single commercial that's being restarted, and huge kudos to our amazing commercials contracts team who are carrying that out along with the support of our safety team. And so that's happening now to ensure that there are adequate safety protocols on a commercial by commercial basis. That's sort of like an individual negotiation with each commercial production. but we do expect to have protocols that will apply on a blanket basis to all commercials as soon as possible, working jointly with those other unions. And then I think I may have forgotten the last part of that question. I'm so sorry, Rebecca. Oh, you're muted. I'm sorry, Rebecca, I can't hear you because you're muted.
It has to do with, sorry, we had, it's a day for doorbells and all the rest of it here, and New York car honks. What is the union doing to lobby officials to get the law changed in LA County to require testing on commercial sets? If you could talk about that.
Absolutely. Actually, this is something that we're, again, working in combination with the other unions on. We do want to see the LA County health order changed. We were not at all pleased with the fact that there's this sort of mushy exception to testing for commercials, short duration, I might note, commercials and similar productions. We think that now evidence clearly shows that that's a mistake to have that kind of exception there, and we are working to try and get the LA County health officer to make that change. It hasn't happened yet, but we're optimistic that it will eventually happen.
Great. Okay, so the next question is, how is SAG going to enforce protocols on productions that are allowed to go forward overseas in areas like Spain? Some productions are being given clearance to continue using actors through Global Rule 1, and even though the productions are using modified minimums and maybe versions of the Safe Way Forward. So no stewards means the responsibilities fall on performers to report violations and risk retribution while in foreign countries.
Sure, that's a great question. We are applying the same standards to productions no matter where they may occur. So productions that are occurring in Canada, for example, productions that are occurring in Spain, we've got productions in Germany and the UK right now as well. We're using the same protocols from this return to work agreement. However, I do want to note the return to work agreement does contain provisions that acknowledge that some jurisdictions have lower community infection rates, and therefore the testing protocol might legitimately be adjusted for that. And so, for example, for productions occurring in Vancouver, BC right now, the community infection rate there is extremely low. So the producers and the unions have agreed to a modified testing schedule in Vancouver for Zone A personnel. This is with the advice and guidance of the epidemiologists, for 2 times a week testing instead of 3 times a week testing for Zone A, with the same protocols in place for Zone B as would normally be there. That's the same type of procedure we intend to follow with all of the foreign production that's occurring under Global Rule 1 contracts or under our full agreements. It is important, though, that performers who are going to travel outside of the country to work check in with the union before they travel, so that if there are concerns about a particular production, we can alert them to that. We're doing that proactively as well for known projects and where we know who the cast are, but it's just a smart move because obviously once you've traveled to that country, the circumstances are a little more complicated. They're also more legally complicated. So it's really in everyone's best interest to have that communication before performers travel outside of the country, but we are monitoring safety on those productions, and we do expect that all SAG-AFTRA members will be protected in a manner consistent with this return to work agreement.
Great. We have a question about trying to become, actually we have a couple different ones, about trying to become a COVID officer. This person has a medical background and hoping to get the chance to work instead of a pop-up COVID company. Any advice that you might have, Duncan?
Sure. I mean, I think
people that do that kind of work and whatnot. Go ahead.
Right. No, I mean, I think it's, SAG-AFTRA members who do want to be COVID compliant supervisors, and especially if they have any kind of medical background, that's fantastic. I know the companies are definitely seeking people with medical backgrounds to be part of that. And if you have both if you have production knowledge and a medical background, then you would probably be in high demand from the companies. You will be required to take a COVID compliance supervision certification course. And that's not something that we don't have a list at this time of approved COVID compliance supervisors or anything like that. The companies are handling that on a company by company basis, subject to the guidelines and requirements that are in this return to work agreement. But it's definitely possible for SAG-AFTRA members to do that if they take the necessary training and meet those qualifications that the companies are looking for. And we certainly would encourage that. As far as whether you're hired directly by the company or through a vendor, it is understood that the companies can use an outside vendor to retain their COVID compliance staff. Those people still have all the same responsibilities and the same authority, including the authority to pause production that I talked about. So it's really just it's just a question of the technicalities of hiring as to whether they go through an outside vendor or whether they hire you directly.
Great. We have a question about indie producers that are not part of the AMPTP. Low budget producers that might have different things. Are they going to be following this or a different agreement? And there was a very similar question just in terms of, is there a variance or a rider for low budget projects?
Sure. A couple of notes about that. First of all, we've been in communication with the Producers Guild and IFTA, the Independent Film and Television Alliance, almost during the entire time that we've been working on this protocol. So they're very aware of this protocol. And in fact, the Producers Guild a couple of weeks ago released their own set of protocols, which are largely consistent with the Safe Way Forward and this document. So our expectation is that low budget and independent productions will follow the same return to work principles that are enshrined in this agreement, with the exception, with the possible exception of the money items, which may be adjusted just the way scale is adjusted for certain low budget productions. There may be adjustments in how performers are compensated for testing, quarantine pay, or sick leave for that purpose. But if we're talking about the safety items directly, those safety items will be largely the same between all these different types of productions. And that's what performers can expect when they show up to set. If you show up to an independent or a low budget project set and you find that those basic safety protections are not in place, you should immediately contact SAG-AFTRA so that we can address that. The last thing I just want to note is there is a provision in the agreement that states that COVID-related costs that are specific to COVID won't be counted for the purpose of budget limitations. And that would be true also for purposes of like low budget contracts, et cetera. Those unique costs that are due to the pandemic, so that's like the cost of paying a COVID compliant supervisor, the cost of doing testing, special COVID sanitation, not normal expenses like just regular cleaning. You always had to do that, so that's normal. But any of those special costs, those won't be counted for budget purposes, so that COVID prevention and protection doesn't push a project out of its otherwise normal budget tier. And also so that there's no disincentive to producers to spend money on COVID prevention.
Yeah, thank you, Duncan. We have a great question here in terms of young performers and young performers, the traditional rules being followed, and wanting to know about studio teachers, and will they still be able to be with the child? Is there going to be any sort of separate classroom experience? Is this going to be different from set to set? And that kind of thing. So if you could kind of talk about that a little bit.
Sure. So just maybe on the young performer issues in general, as far as studio teachers go, their role will be the same. To the extent that a studio teacher is serving in a welfare role, which depends on the contract and the state in which that person is working, that role really can't be performed remotely. So that studio teacher will be on set carrying out that welfare role. They'll be tested in accordance with the appropriate zone protocol, et cetera. The agreement does allow for remote instruction of young performers. And for any of us who have kids in, well, in my case in Los Angeles Unified School District, but I think around the country, lots of students are using distance learning right now, being taught over Zoom or other things. And that is going to be allowed for young performers on set as well. So it depends on the production, but it's quite possible that we'll see a situation where there are one or two studio teachers on set in a welfare worker role, and then the actual instruction of the young performers will be carried out by offset studio teachers by remote distance learning. The other thing I do just want to mention, because I know sometimes people ask about it, is what about COVID testing for minors? Everyone has to be COVID tested. There is no exception based on age. Even infants on set have to be COVID tested because infants can be vectors for COVID. But I do want to note that that there are a variety of ways of collecting the sample necessary for COVID testing, including an oral swab. So this is not something that should be highly distressing. It can be done in a way that's appropriate for even young children using oral swabs.
Thanks, Duncan. We have a question about somebody that was on a Zoom for the Schedule F performers and series regulars and quarantine pay. And can you make clear about the line break for regulars making a certain amount of money or Schedule F performers making a certain amount of money in terms of quarantine pay? Can you help illuminate how that landed? And also thank you and all the people that participated with that. It was really incredible work. So if you could lay that out a little bit.
Sure, absolutely. So let's start with series regulars. If you're a series regular on a television series, then if your episodic compensation is less than $20,000 per episode, then you will automatically be entitled to quarantine pay for the time that the producer might require you to quarantine. A great example of this is if you're on a series that's shooting in Vancouver, the Canadian government requires a 2-week quarantine period for any performer coming in from the United States to Vancouver. So that 2-week quarantine period, if you make less than $20,000 per episode, will be paid at the Schedule B weekly rate, weekly minimum. And if for whatever reason you do some work on some of those quarantine days, so instead of it being a full 2 weeks of quarantine, maybe you do some rehearsals by Zoom on 1 or 2 of those days, then that would be prorated. But all of the quarantine days when you're not doing any other work for the producer would be paid for at that rate. If you make $20,000 or more per episode, then you will need to individually bargain for how your quarantine pay is addressed. As far as Schedule F performers who aren't series regulars goes, that threshold is $40,000 an episode. So if you're a Schedule F performer who makes less than $40,000 an episode, you will also be entitled to the Schedule B rate for quarantining. And if you're working on a feature film as a Schedule F performer making less than $80,000 for that feature, then you will also be entitled to quarantine pay. If you're above those thresholds, then you will need to individually negotiate for how quarantine pay will be dealt with. And if you're on a closed-end multi-part picture, then you will be entitled to quarantine pay unless you make at least $20,000 per part of that multi-part picture and at least $80,000 for the entirety of the multi-part picture. So that's a double qualification. If you fail either of those 2 tests, then you get compensated automatically for quarantine pay. If you're above both of those thresholds, then you need to individually negotiate for quarantine pay. I do want to note that the agreement explicitly protects the right of those performers who are above those thresholds to individually negotiate for those amounts. That's not a guarantee you'll get it, but that is a guarantee that you have the right to negotiate for it, and no one can say to you, well, no, we don't have to negotiate over that. They do have to at least negotiate with you over that on a going forward basis.
Great. While today is obviously about the AMPTP and unions agreement, we do have and this could apply to anything, though this was specifically about a commercial that was booked. So I just want to ask this and then frame it up for any performer. So they were given this to sign. Performer understands the performing service may involve certain risks. Those risks includes, but are not limited to, the risk of any illness, personal injury, bodily harm, emotional distress, and or psychological harm that the performer may suffer or incur as a direct result or a direct or indirect result as performing services. You can see where this is going, Duncan. During the pandemic,
I can see.
The performer acknowledges these risks, assumes responsibility for performing the services, waives their rights, and so on and so on and so on, and basically wanting to know what the union's position on this and what should they do if they're ever in a position like this again.
Sure. Well, so for any contract whatsoever, we reject the idea that a producer or an employer can request you to waive any of your rights or require you to waive their responsibilities as an employer. Under federal law and under state law, it is the employer's responsibility to maintain a safe set. And so if you are asked to sign something like that, I recommend that you decline to do so. If they tell you we're going to not give you the job unless you do this, well, first of all, you should contact the union and let us wade in and get that taken care of for you. But in the end, if you're put in a position of choosing to sign it or not get the job, from my perspective, if you're working on a union contract, you can go ahead and sign it because it won't be valid given the fact they haven't gotten negotiated it with the union or gotten our approval for it. Just as a side note, for anyone you might know who's a non-union performer, if you're working outside of a union contract, that is not necessarily true. So that is a protection that only applies when you're working under a union contract. So please be aware of that. You may still have other state and federal law rights to resist those kinds of waivers, but that same protection that you have under a union contract won't be in place. In terms of specifically this return to work agreement, it expressly states that the employers will not seek to have any kind of waiver of liability signed by performers. And so if you are presented with one, please alert us immediately and we will address it with the producer. I do want to note it is okay for them to ask you to sign a release form so that your COVID test can be provided to production, the COVID safety supervisor, et cetera. That is okay. That is specifically allowed in the return to work agreement, but whatever release you're signing cannot include any waiver of liability for the producer. And if it does, please alert us and we'll get it taken care of.
Duncan, there was a clarification about that Schedule B minimum for 3,500. Is that 7 days?
So it is for 7 days in the sense that quarantine time is not time when you're doing anything else. So it's each 7-day period, you would receive the Schedule B weekly minimum of $35.75. And if that's prorated, it's prorated on a 7-day basis.
Great. All right, we have a question about being required to quarantine on location prior to returning for work. And so is that when we are due the compensation for time under quarantine? That's what this person wants to make sure they understand.
So just to make sure I understand the question, I think you said quarantining on location prior to returning for work, and I want to know what that means.
Reporting for work, I'm sorry.
Okay.
I might have misstated it.
Okay, yeah. So, right, if you are, the quarantine pay provisions of the return to work agreement are specifically intended for where you say, for example, travel somewhere. This could be a foreign country. It could be somewhere here in the United States where the government requires you to quarantine for a certain period before you can go to work. It covers that. It also covers if the producer just chooses to have you quarantine for a period during that time. What it doesn't cover is quarantine during time period when you are actually working. So if you are doing what some people are calling a bubble production, where you're in quarantine while you're working, you're going to need to negotiate with the producer for the additional compensation that will flow from the quarantine that's happening while you're working. But a pre-work quarantine will be covered by these provisions.
Great. What financial protections are in this agreement specifically for background actors, stand-ins?
Sure. There's a few. First of all, the sick leave provisions apply to background actors and stand-ins just like they do to anybody else. And there's a specific piece of that, which I didn't already mention, but I think it's really important to note because it benefits people who are hired on a daily basis, really, which is that sick leave applies not just for the time period that you're contracted for, but the time period that you reasonably anticipated that you were going to be working. And so just to give you an example, let's say as a background performer, on a Monday, you're asked to test on a Tuesday and then told you're going to be working on Thursday and Friday. So you go in and do your COVID test on Tuesday, that comes back negative. Then you report to work on Thursday to work, and let's say that your temperature screening comes back positive, and then you're not able to work on that Thursday or Friday. If this were limited just to your contracted days, then you would just get paid COVID sick leave for that one Thursday. But in fact, because you'd already been informed that you were going to be working the Thursday and the Friday, you will be paid COVID sick leave for that full time period, and you'll receive benefit plan contributions on that sick leave payment as well. And that's true also for day performers as well. So, I mean, that's one area. Another area that's specific to background performers that I mentioned already is the fact that testing stipends for background performers will generate benefit plan contributions, with the sole exception of the scenario where you aren't subsequently employed by the producer. That would happen if you take a COVID test and you test positive and as a result aren't able to be employed by the producer. You'd still get paid the stipend, but due to legal limitations on contributions into benefit plans for non-employees, they won't be able to pay that benefit contribution. But for the vast majority of background performers who will be testing negative and then going to work for the producer as a result, they will receive benefit plan contributions for that testing time. And then, of course, all the rest of the protections in terms of the safety protections apply equally to everybody. And in fact, from the very beginning, our Safety Commission adopted a principle that was endorsed by the Executive Committee that said that all of our safety protections should apply regardless of role or status in the production, and that safety is something that's it's like a human right. It's not something that depends upon what your job title is, or how many days you work on a project. And that's the philosophy that underlies all of the safety protections in this agreement and in all of our documents.
Yeah, thank you, Duncan. It's a good reminder. I mean, I think that was a really critical and key moment, and I was really grateful to be involved in that conversation with the commission and with the executive committee, unanimous in both cases. There's a question here about actors being restricted from traveling to certain states to avoid COVID exposure. Will there be a set quarantine in place before or after filming? Can you talk a little bit about that?
Sure. So these safety protocols, this return to work agreement doesn't contemplate any kind of automatic quarantine. And so it is, the safety procedures have been designed around an environment where people are not quarantining. And so it's not expected that it will be part of a normal work experience to have a quarantine. There will be times when performers do have to quarantine, especially where they're traveling outside of their home area to work. That won't be in all cases. It depends on the jurisdiction that they're going to. But quarantine itself is not a normal or standard part, either on the front end or the back end of a job.
Great. We have a question about a SAG-AFTRA member who also works in healthcare. That's who they are. They're seeing people claim to be able to do COVID PCR nasal testing, but they are not RNs. I have a lab license. I know only a nurse or doctor can do nasal swabs. The only exception is a self-test. How do we know people are conducting the tests are licensed and know what they're doing? What's in place in terms of testing?
Great question. I actually expect that a lot of the testing that'll be done will be through self-administered swabs, especially oral swab testing, for example, or so-called spit test, just because it's more widely accepted by people and people like it better. But there are definitely productions that are still using the nasopharyngeal swab, which is the sort of longer upper nasal swab, and then also the anterior nasal or dual nasal swabs. Those do need to be, those samples, if they're not self-collected, which certainly nasopharyngeal swabs are not normally self-collected. Can't imagine anybody wanting to do that. Those do need to be collected by properly medically trained individuals, such as an RN or others who are able to do that within the scope of a licensure, given the rules of the particular jurisdiction. So if you become aware of a production where somebody who shouldn't be doing that is doing it, please alert us and we will get it corrected. That's the first time so far that I've heard of that. So it may be an isolated incident, but if somebody can bring it to our attention, we can address it without identifying what the source of the report was.
Great. Are there new rates for performers being offered for work before a vaccine?
If I'm sort of interpreting that to mean, are there higher rates or some sort of hazard pay or something like that? If that's the meaning of that question, the answer is no. All of the existing contract rates remain in effect during this time period. They're not lowered, they're not raised, they're the same. Obviously, there may be some circumstances where performers get additional compensation because of testing stipends or because of quarantine pay. But the fact of the matter is the producers are spending a very large amount of money on COVID safety protocols. That's been independently estimated at between 20 to 25% of production costs in some cases. So I think throughout the process, our leadership and our staff realize that there's a real risk associated with increasing the cost of employing performers, which is reducing the number of jobs. And we've gotten consistent feedback all across the membership that people want to return to work in a safe way, but they want to get back to work. And so we were very concerned about what the impact might be of increasing the cost of employing performers on productions in terms of getting people jobs. So that is not part of this agreement. And by the way, it's not part of this agreement for any of the other unions either. I think we all shared that philosophy.
Yeah, definitely also on the safety piece of it, that was the real focus of this, and not trying to deal with other issues in this. So that's helpful for people to understand. This is a person who wrote that they had worked background, and the protocols that they were emailed by the production showed how they could use hand sanitizer before putting on our masks and after taking them off. But only the principals on that show were given hand sanitizers to carry with them. We were given sandwich bags, told to put the mask in the bag and then in our pocket. I've stopped doing that because I was only spreading whatever was on the outside of the mask. Are plastic bags the correct protocol? And why should only principals get hand sanitizer? Why do only principals get provided masks?
So it's not correct under this return to work agreement that only principals get provided masks. Everyone on an equal basis is supposed to be provided PPE. And so if you find yourself on a set where something like that is happening, where PPE is only being provided to principal performers, please contact us immediately and we will address that. That is not correct. Same thing for hand sanitizer. Hand sanitizer is to be made available to everyone and is not to be hoarded like gold or provided to only certain groups of cast or crew. So please alert us to that. None of that is consistent with the return to work agreement. I don't know when that happened. Obviously, this agreement took effect this past Monday, but I would encourage anyone who experiences something like that to please let us know so we can get it corrected.
Yeah, I mean, I can't emphasize what you said strongly enough, Duncan. If people find themselves in a position where they aren't being treated correctly with this agreement, they need to speak up for themselves on the set. They need to contact the union. They need to do all that because, you know, all of this relies on all of us working together to make that safer environment. And I'm first off, that's terrible and wrong. And we can only step in when people alert us to it. So I'm hoping that the person who wrote that question will also follow up with us on more specifics. And if you find yourself in that situation, I mean, this is what the union is here for. I mean,
absolutely. Can I just also say, I mean, if you felt comfortable, you could approach the COVID compliance supervisor on that set as well. But if you don't feel comfortable doing that, it's completely perfect for you to contact us and we can address it without identifying you as the source of it. So, so please don't hesitate to let us know about those situations.
Yeah, absolutely. Do not, please call the union, call the safety hot, you know, the hotline. Don't wait to do that. The next question is, first, thank you for all your hard work and commitment to protecting everyone's safety. Secondly, can you specify if these rules, you mentioned the low budget productions, what about new media web series and low budget local commercials? And is there going to be a difference in the accommodations? And obviously you kind of covered some of that before, but I think they're kind of tossing in new media web series and all that. So I just want to make sure that we've given a full answer.
Yeah, the same principles apply to all SAG-AFTRA contracts. Obviously, the implementation can differ because the circumstances might differ. So, for example, you know, on a large budget television series, you will probably have a larger COVID compliance staff than you have on, say, a web series, a low budget web series or something like that. But still, those core functions have to be carried out. And the safety level that's necessary is the same. I mean, the virus doesn't care whether it's a $100 million budget or a $10,000 budget. As a person, the impact on you is the same. So the principles are the same, and the implementation may vary based on those specifics, but the same concepts are there, and you should expect the same sort of experience as far as it relates to testing, as it relates to PPE, sanitation, COVID supervision, et cetera. I will just mention that for shorter duration productions, obviously a different testing protocol would be in place. If you're on a production that lasts 1 or 2 days, you're not going to have 3 times a week testing because you won't get to the point of 3 times a week testing. So we do have a specific protocol for short duration productions that takes that into account. But again, it's still under the same philosophy, which is the point of testing is to keep everybody safe on set. And so it doesn't compromise the benefit of the testing.
Great. So there is a question here about the paying for the day of testing. This person sounds like they might have been a little, if an actor, producer working on one of our projects and 5 of 47 members contract COVID-19 as its workers' compensations insurance that pays our sick pay time off is the question. And how much is this new cost of production from workers' compensation insurance? So they're trying to get clarity on the day pay rate for testing. So if you could kind of go over that piece again, and then hopefully you can loop in the rest of that information. It's kind of a lot.
Sure. Sure. So the testing rate for any day when you're not working for production, and again, there's exceptions, which I mentioned, but so let's set aside for the moment series regulars and Schedule F performers and background performers. Everybody else, if you are doing testing on a day when you're not working for the producer, there's a flat $250 stipend for that testing day, regardless of how long the testing process takes. This is assuming the testing is outside of your home. If you're sent a home test kit to do at home, then this doesn't apply, and a different $20 testing stipend would apply instead. But if you're testing out of the home, going to a testing facility on a day you're not doing any other work, it's $250 a day, unless you're a background performer, in which case it's $100 for that day of testing. And if you're a background performer only, that will be subject to benefit plan contributions, assuming your test comes back negative and you're engaged to work on the project. So that's how the testing piece works. If you're doing testing on a day when you're otherwise working for production, for the producer, then your time for testing is just added to your time for that day and paid accordingly. And as far as the workers' comp piece that was asked about, workers' comp varies state by state. So I can't give you one answer that applies to everybody. Some states, such as California, are recognizing, at least for now, that anyone who is working who comes down with COVID, there's basically a presumption that that COVID was contracted at work. And as a result, there's workers' comp coverage for that, both from a medical treatment perspective and potentially from an income perspective. That is not true in every state. In fact, it's not true in most states. And so that is a question of state law. The sick leave provisions in this agreement, however, don't, they aren't contingent upon the workers' comp status in any particular area. The sick leave provisions that I talked about apply everywhere in the United States and outside the United States where performers are working under our contracts. And so you may, if you are in a state where workers' comp applies, there may be additional benefits that you can access. And if you're in a state where it doesn't, then unfortunately that won't be the case.
Great. This question says, from all the reports that they have heard, the protocols for major films and TVs sound like they're being followed very well. And they're wondering about shooting in regions other than their own and their ability to pay for and follow all the protocols such as testing and safety for wardrobe, hair, and makeup on set. And is there a way for us to help monitor that and monitor it more closely?
Sure. I mean, I think we're monitoring it pretty closely, obviously within the limited resources that the union has. We don't have the kind of resources where we could have, and nor would it be possible, I think, for anyone, any union to ever have a rep on every set every day. But we do have an incredibly dedicated and hardworking team of field representatives who are out on sets every day, going to trouble spots, proactively checking certain places. And so that's there. But really, we also have to rely on our members to keep us informed of problem areas. And I can't emphasize strongly enough that if you alert us to a COVID safety concern, we won't identify you. You can present us that report anonymously, or we can protect your identity and still bring that concern to production. So if you were concerned about harming a relationship or somehow impacting your employment, that's what we're here for, and we're happy to do that. So the last thing I'll just say is for anything that's not subject to these detailed protocols where we've been doing pre-production, individual project-by-project meetings, an immense amount of time and energy has been devoted to those areas to make sure that the protocols are clear for each individual production, like in commercials, and to make sure that performers are protected. So we do expect a consistent level of protection across all projects, and we are taking every step we can to make sure that's enforced, but we do need our members' help to do that.
Great. We had a question about travel and being able to travel with 6 foot distance, and it wraps into another question that we received about, being comfortable going to work because of the protocols, but having concerns about having to travel through airports, airplanes, and otherwise. And this person also includes something about the fact that they were able to self-drive much longer distance, but that might not be possible for those traveling outside the U.S. So any thoughts on that, Duncan?
Yeah, I mean, I think the first thought I would just share is, and I think I sort of hinted at this at the very, very beginning of the presentation, but um, no set is going to be 100% safe and no process is going to be 100% safe. So it is something where each performer is going to have to decide for themselves what level of risk they're prepared to accept. If, for example, you're offered a job where clearly you're going to have to fly to get there, let's say you're based in Los Angeles and the job is in Australia, or the job is in New Zealand, or the job is in the UK. Clearly, you're going to have to get on an airplane in order to accept that job. And that means exposing yourself to the risk of being on an airplane. And barring, some unique circumstance, if you're not a performer who somehow has access to private air transportation, that's just a risk that's inherent in the job. And if you don't feel comfortable with that risk, you may not want to, as hard as it is, to accept that work, because there's nothing that the producer or the union is going to be able to do to make that sort of commercial air transportation any safer than it is. Having said that, all of the protocols that are in place are intended to try and reduce that risk, including things like pre-travel testing, including things like testing once you arrive at the distant location, including provisions that provide for the employer's responsibility to pay for your lodging and per diem if you have to remain in a distant location as a result of contracting COVID while you're working. So there's a lot that's been done to try and mitigate that, both financially and in terms of the safety. But the bottom line, I would say, is use your creativity. But there will probably be some jobs that for some people just aren't the right fit during COVID, and where they may have to say no to them. And by the way, that could be true due to what's the nature of the job itself. I mean, if you have a job that has extensive intimate scenes and you happen to be immune compromised or live with an immune compromised person, or just don't feel comfortable with that under these circumstances, then either you're going to need to negotiate changes in what's the expectation or how that'll be carried out, or it may just not be the right fit for you at this time for that position. So those are very personal considerations that I think everybody has to evaluate.
Yeah, I tried to combo a whole bunch of things because we had a lot of questions in this bucket. So what about people, you're going to go to a workplace where the 6 feet of social distancing is mandatory. What about the airplane travel itself? In terms of, some people are, you're not going to have social distancing is not necessarily always possible in that case. Certain airlines, I just got an announcement that an airline is going to hold, middle seats out until January, those types of things. Is that something that you could negotiate individually? Maybe additional seats purchased or otherwise? I'm aware of some actors having done that where they're being creative about their bubbles. So I don't know if you have additional thoughts or advice.
No, I think that those are some great pieces of advice right there that you just gave. I think it will require individual negotiation. The protocols, the return to work agreement doesn't specifically require the producers to do something different in that area. So it does need to be negotiated. Obviously, there are some, like you said, there are certain airlines that people may feel more comfortable using because of steps that they're taking. I've heard of airlines saving middle seats out. I've heard of airlines that are saying they're going to start doing some sort of testing, et cetera. So those are options that performers should consider. But I would recommend, sort of considering that and having it negotiated in as part of the process of getting the job, because once you've committed to doing the job, I think that will be, it's not that you can't maybe get some of those things agreed to, but it'll probably be a little more difficult.
Gotcha. You mentioned intimate scenes, and there was, questions about mannequins, and will there be any additional testing? Are they gonna, this person clearly had a sense of humor.
Testing of mannequins is not part of the return to work agreement.
No, I think they might be referring to a certain soap opera. There you go. Or Saturday Night Live skit, either one. Are they, given that you could potentially get a false negative test out there, is there going to be anything along those lines to handle if somebody should get a false negative? Can you talk about that for a little bit?
Sure. I mean, one of the reasons that our testing protocols really require a certain type of test is to avoid false negatives. And so the return to work agreement requires that all tests be PCR or rapid PCR tests. We do not allow, the return to work agreement does not allow antigen or antibody testing. And setting aside antibody testing, which everyone agrees is inappropriate for determining if someone is currently infected with COVID, even antigen testing, which is used in certain circumstances, from our perspective, has way too much of a risk of false negatives to be suitable for the production environment. And that's why it is not currently accepted. That may change in the future due to science, due to the tests evolving in a way that could make them more useful. But for now, it's PCR and rapid PCR tests only. And those tests do have a well-established level of accuracy and specificity that minimizes the risk of false negatives. There is still a chance of false negatives, to be sure. And of course, the thing about a false negative is you don't know that it's happened until later because the test didn't catch it. But the accuracy rate and specificity rate for those tests is very high, up in the upper 90 percentile of that. And so we're hopeful that by combining that with the other layers of protection, the frequency of the tests, for example, the zone system, that any impact from false negatives will be minimized.
Well, Duncan, I know we've kept you longer than this is probably one of our longest PTEOEs ever, but there's just so much to cover, and I appreciate you laying everything out. I want to let people know that we're watching today that we will do additional President's task forces on this and other safety topics. And as this is going forward, I know we're going to bring some people in with their, personal experiences. I mean, it's going to be a different, everybody's going to have a different, like you spoke about, risk tolerance. People should absolutely assess this for themselves. I'm glad you brought up, as you and Gabrielle and David have from the beginning, that there is no safe set, it is only safer. I want to just emphasize to every single member, and I know we probably have some folks from other unions watching, that this collaboration between all the unions, leaderships, really was, really was something that we've always had good relationships with the other unions, and I'm very proud of that for SAG-AFTRA. But I will just say that just from my front row seat, being able to watch the collaboration between David, yourself, Gabrielle, Cameron, and others to really put forward the collaboration with the other unions and those member leaders' works. It really has been one of the most significant things that I've ever witnessed, maybe except for the merger of our unions some years ago, and how heartened I am by that partnership and the collaboration that we're going to all move forward together with these protocols to give people the safest possible way forward. And that if the science changes, we're also, these protocols can change along with it. I think that's also really important for people to know. And I'm just grateful for all the time and effort that you and all the SAG-AFTRA staff team that you worked with put into it, to all the member leaders. And so I'm going to wrap it up today, but know that we will do more of these. And please make sure that your friends are paying attention, and all your member friends and others, so that they really do. This is only going to work if we all do it together. So it's just a great discussion. For more information, and if you want to read through the protocols for this and all the other areas of work, you can see all of those at sagaftra.org/back-to-work. Check it out. And I just want to thank everybody from the President's Task Force, all the members who joined us today. Please make sure that you follow SAG-AFTRA on social media, Facebook, Twitter, and Instagram, and that you're following and subscribe to the YouTube channel so you can take a look at all the videos in the gallery. And I hope that everybody has a safe weekend. And again, thank you, Duncan, for the great work. Bye, everybody.
Thank you.
Yeah.